Good afternoon, everyone, and welcome to our latest webinar for the Business Resiliency Task Force. The Grand Prairie Chamber of Commerce and the City of Grand Prairie and the County of Grand Prairie all working together to try and navigate business and those in business through these interesting times that we're in this year. I was very excited, looking forward to this chance to talk to someone I've known for quite a while, and an organization that I've volunteered for since 2002. Ainsley Miller joins us from the Resource Center for Suicide Prevention, and we want to let everyone know that the session is being recorded so that we can share it again in the future. So Ainsley is going to talk a little bit about supports and available programs, and just in general some good tips for people as they're trying to keep themselves going through this this time that we're in. So we really appreciate Ainsley joining us, and there will be a chance for questions. You can type your questions into the chat window. We'll keep an eye out on that. And if there's a question you'd just like to ask, Hetty can unmute you, and we can get you to ask that. But we'll let Ainsley maybe introduce herself a little bit and then get into her presentation. Welcome, Ainsley.
Thanks, Tom. So a little bit about myself for starters. I am not a program director. I'm not a counselor. I'm not offering any advice, medical diagnoses. I manage the programs, and all of the coordinators work for me. So they are the ones with all the experience. They're ones with all the training. I'm giving you a presentation which is an overview of a bunch of different programs that we run. And before we get too far, I do want to tell you this is a conversation about suicide prevention, and a lot of my information is about that. So if you're having a moment where this is triggering and this is a lot for you to cope with or to listen to, turn your camera off, stand up, roll your shoulders, take a few deep breaths. I can't see you, no one can see you, so it's your moment to hear the information. Rejoin whenever you're ready. Ask any conversational questions. You can send them privately, or you can send them to the group. So the information is a lot, and I really thank you for joining the presentation, because there's a lot of information out there. I'll try and keep it as an overview of everything, and still give you some really good information and great sources for where you can look. Okay, do I have the right screen up? Can everyone see my PowerPoint? Yeah. Okay, suicide prevention and mental health for employers, families, and individuals is what we're going to talk about today. I'm Ainsley Miller, and I work at the Resource Center for Suicide Prevention. So what we're discussing today is first the resources, prevention, information for employers, information for families and some statistics, individual mental health, and the programs that we run. Before we do anything, I'd really like you to know these are the helplines. These are places that you should know. They're places you should be able to reach out to. Take a screenshot, use your camera, take a photo. These helplines are 24/7 helplines and distress lines. We find ourselves in this position due to global circumstances out of our control, financial and health crisis that we couldn't imagine. And the reality is that your mental health was important last week. It'll be important next week. There is a lot of help available and nowhere to look for it. Here in Grand Prairie, if you call 911 for an emergency, you can ask for the PACT team. They're the police and crisis team. They're a joint mental health police team available for response to a mental health crisis. And I really recommend using them if that is something that you need to do. The RCMP are specially trained in mental health issues, and they work with a psychiatric professional partnered to help provide a sensitive response to crisis and criminal issues that involve individuals with mental health concerns. Another resource that we have here in the region is ICAT, the Integrated Crisis and Access Team. So that's run by Addiction and Mental Health for adult and youth intake. It is in the Aberdeen Centre on the 3rd floor. They do screening for addiction and mental health issues and referral to the most appropriate services and supports. So they are open Monday to Friday, 8 to 4:30. The fact that we are undergoing this crisis makes no difference. You should still be considering that they are a triage service for a mental health issue. They're open and they are taking clients when they need to. We're really lucky to have them, and I use them as a referral all the time. You may have never experienced prolonged anxiety before or never needed more help. Maybe you did have anxiety struggles and used some negative coping techniques. I hope not. If you had anxiety and managed it and had positive outcomes, you've been building resiliency. And through the coronavirus, we're all collectively experiencing anxiety from one moment to the next. And the tips on handling anxiety remain the same, whether it's this crisis or any other. Here's a little bit of information about just coping with anxiety. Prioritize your self-care routine. Avoid excessive consumption of the media. Focus on things you can control. Talk to families and friends. Eat well, stay hydrated. Practice calming techniques. Distract yourself with games, books. Notice your feelings and write them down, and keep busy doing things that you enjoy. You don't need to know everything about preventing suicide to help, and the information that we're going to talk about today can be triggering. So if you need a break, turn off your camera, turn down the volume, take a few steps away, and have a few breaths. Come back into the discussion whenever you want to. I have a lot of information to share, and the next dozen slides are information on suicide, depression, and statistics for our region. Not every person who dies by suicide has a mental illness. Not every person who has a mental illness dies by suicide. There's a need to understand that poor mental health can lead to poor decisions, and this trauma we're experiencing requires new skills and behaviours from all of us to collectively move forward. The word suicide is one of those words we never really use or talk about. It's something that's never going to affect me or anyone I know until it does. In recent times, we've all seen the images and news on the 737 MAX planes that have crashed. We've seen the public outcry and government reactions and the grounding of those planes, immediate action. So imagine this suicide numbers in Canada equates to the same numbers as if 2 of these planes pictured crashed every month of the year, killing everyone on board. And yet the topic and numbers are shown around suicide, then the discussion ends and people shy away from it. It's a big number. Recent studies are now saying that up to 135 people are affected by any suicide loss. The 7 to 10 number is just immediate family. When you think about extended family, friends, co-workers, acquaintances, the number rises dramatically. And this 25 to 30 attempts is really a general number based on all suicide loss. It actually rises exponentially for youth. So to bring things closer to home, here are the stats for Alberta. Since 2015, over 600 people in Alberta have died by suicide each year. That's more than in motor vehicle collisions. In 2018, 7,254 Albertans visited the emergency room for suicide attempts. So every day in Alberta, more than one person will die by suicide. And in the region north of Edmonton, we see higher rates than in the rest of the province. So for 2017, in the North Zone, it was 183. In Edmonton, 166, Calgary, 159, and the South Zone, 129. So even if you consider population, Our rates are much higher here. We have more to be concerned about. Of those 600 deaths a year in Alberta, 3 out of 4 of them are men. There's a lot of stigma attached to mental health, especially in men, and talking openly about mental health and suicide is the first step to prevention. Opening that conversation, as well as education and training, are the best tools that we have. Depression is a disease. It's caused by changes in the chemicals of the brain. It isn't a character flaw. Doesn't mean you are bad. Doesn't mean you're weak. People who are very depressed can feel so bad that they think about suicide, and they might feel hopeless or helpless or worthless. But most people who think about suicide don't want to die. They may see suicide as a way to solve a problem or end their pain. There are warning signs to look for. Most of the time, we can notice things about friends or family that are struggling with their mental health. It might be something that we see in their behavior, or maybe it's things that they're saying, or even mood changes. These are some of the things that we can look for. You might see a combination of things, such as someone who's showing loss of interest in things they used to enjoy, who's also isolating themselves more than COVID-19, and having conversations and talking about feeling trapped. Check in with yourself. Where are you doing? How are you doing? There's something called a mental health continuum, and I know it doesn't show up beautifully on my screen. I apologize. It's an assessment tool, and I'd really encourage you to consider using it or to reviewing it. Changes in mood, from calm to irritable to angry through to excessive anxiety and panic. Changes in thinking and attitude, from the ability to concentrate, displaced sarcasm, negative attitude, through to suicidal thoughts. Changes in behavior and performance, from physically and socially active through to withdrawal. Physical changes, from normal sleep patterns through to can't fall asleep or can't stay asleep. Changes in addictive behaviors, from limited alcohol through to addiction. You can share the mental health continuum with staff. Consider it a tool to do a momentary check on yourself. There is healthy, reacting, injured, and ill. You may not notice that you're veering into injured behaviors, and just like a physical injury, you may need help from a professional. Instead of using social media to diagnose the weird skin rash or your struggles, you need to take note of these troubling signs and see a professional. Don't let the first person you reach out to be the last one. Not every solution meets every need, and not every physician or counsellor will be a fit for you. Don't give up and try the next one on the list. I had an injury from a car accident years ago, and I took the view after my treatment that physio was not valuable, not realizing that the physio I was assigned wasn't valuable. And that when I had a recommendation and saw a different office, I rapidly improved, and now I swear by them. It is the same with your mental health. Not everyone will be the right fit for you, and not every solution will be yours. And here we are amid the coronavirus, with a series of impacts that lead to increased mental health difficulties. If you are working remotely or asking it of your staff, according to the US Veterans Affairs, quarantine for 10 days leads to behaviours equated with PTSD, avoidance and unreasonable anger. So identify coping skills, find social supports who can handle a crisis, and identify professional emergency contacts. Be specific, listing adaptive changes such as reducing your exposure to some news sources, and always offer up helplines and hope. You're going to want to check in on people that you have concerns about. You don't have to be perfect at it. I'm going to follow through with some steps to talk through someone about their intentions if you do need to offer that help. And again, I appreciate you joining the presentation today. These are tough subjects and you're looking for help and resources, so you're doing great. Thank you. I've seen a considerable jump in crisis calls and requests for resources to respond to someone in crisis. And we are not a crisis line, but I'm so grateful that people are reaching out for help, and that they want connectedness, and we do all that we can. So knowing that there's an increase in help-seeking behaviours, someone might be throwing out red flags to you and you want to know what to do. So anxiety and depression can make a person feel very isolated and alone. Sometimes the best help is just acknowledgement. Letting someone know you've noticed something isn't right is a powerful thing. It's showing that they're being noticed and that someone cares about them. It's okay to feel unsure about talking to someone. We worry about saying the wrong thing. Thinking of it this way, if you saw someone carrying something heavy, you'd ask them, do you need any help? So approach them with intention. So basically saying you're prepared to have a serious conversation with them. Make sure you choose somewhere comfortable for both of you that gives you some privacy for interruptions. Just talk. Ask them in a way that feels comfortable for you, and be specific about what you've noticed. You seem to be down, upset, you're not yourself. Can I help you with something? There's no right way to have this conversation. Be thoughtful and genuine, especially non-judgmental. If you do get off track, say something that doesn't feel right, be honest and bring it back. Sorry, I'm getting off track. Start the conversation again. They'll appreciate the honesty. Using open-ended questions encourages conversation. How long have you been feeling this way? If you ever think that a person is suicidal, you need to ask them directly, are you thinking about suicide? By asking the question, you've shown that you're listening to them and that you care. It's not an easy question. Many studies have shown that someone who might be at risk of suicide asking them if they are at risk does not increase suicides or suicidal thoughts. So don't be afraid of that word or that question. The flip side to asking is to listen. There's a really good chance this person's in emotional pain. Let them tell their story. Listen carefully and learn what they're thinking and feeling. Listen to the description of their problems and find out where frustration and stresses are coming from. Don't rush the conversation. What they're going to tell you will take a lot of courage and probably time to get it off their chest. They may be concerned about what others think of them. Listen without judgment. Don't jump in with advice right away, and don't try to fix their problems. You don't need to. You just need to give them a safe place to vent. Research shows acknowledging and talking about suicide may in fact reduce rather than increase suicidal thoughts. Offer them help in seeking professional support and provide information and ways on how to do this. Resources they may need could be an employee assistance program, 24-hour helpline. In some cases, it might be the family doctor or the ER at the hospital. Don't forget the PACT team and ICAT as options. Remove access to anything that they may have, such as alcohol, drugs, or medications, which alters their thinking and may be a threat to their lives. If they have firearms or other lethal means, they should be removed. And that's asking them the question, what were you considering? What do we need to take away to make you safer tonight? Set up a safety plan with them. That could be a regular check-in, a list of resources to call, and if they need to talk with someone until they get to a professional, make sure that you know where you can send them. Be prepared to advocate for them. Sometimes it might take a few tries to get them the help that they need. Plus, they might be in a state and their thinking isn't clear, and they might need someone to help them organize their thoughts. Check in with them. Follow up at a later date. See if they found the resources. Show that you care. They might be feeling alone. They're still stressed. They still have the same problems. It's important to let them know that you care and that they aren't alone. It's not your job to fix them. Sometimes you see things differently than a person who's going through the struggle. It's their struggle. Don't take it on. Don't try to fix it. Get them someone who is qualified and able to help, and let them know there's hope. That's really important. So Alberta Health Services offer a lot of tips on communicating about suicide, and I want to point out the avoid, try, and why. A gentle correction to died by suicide helps reduce stigma in simple, non-judgmental language. Suicide is preventable and we can help. And part of that is connecting and removing barriers and to connecting people to getting help, promoting support and hope. And talking about suicidal thoughts can help someone who is struggling. Saying the words doesn't put the idea in their head. They would have thought about it already, and now you're giving them the freedom to talk to you as a safe place for their fears. This isn't simple. It is a complex problem and it needs to be approached in many ways. Always give people helplines and places to seek help. So you're taking in a lot of information, and I want to take some of the coping skills I mentioned to heart and follow this up with some big breaths. Relax your shoulders. Think about social connectedness. Every positive coping skill you use, take note of it, and when there are other stresses, know that you managed this stress with that coping skill. You're building resiliency, and it's important as a life skill, so acknowledge every win. We all have a role to play in preventing suicide. The helpline's 24/7. If you want to share the Alberta Health Services messaging on help seeking, it's easily available and should be widely shared. We may see an increase in attempts and increased negative coping skills, and talking about where to get help is important. So start here. Take a photo, take a screenshot, share it on your social media, say to people, I hope you're okay. I'm okay. I want my circle to know where to go for help if you don't want to talk to me about it. If you think they might prefer using a text as opposed to a phone line, the text line is 686868, and it's on that other previous number I gave you. And there's also that's a two-way communication, so it's the same as speaking to a 24 helpline. The other one is the Alberta Health Services text. It's a one-way service. It's sent out daily, and it has positive messaging and stress coping skills. I'm going to bring that up on another screen. So one of the things we talk about, prevention, intervention, postvention. Most of the work that we focus on in the Resource Centre is prevention. So you might hear the name and think that we're all about intervention and grief support, but that's only a part of what we do. The focus is on prevention, and that looks like education to promote mental wellness, programming to build resiliency, reducing stigma, building supportive environments, and instilling hope. So if you don't have it in you right now to do some of those things, step back and take care of yourself. Follow all the rules, lead by example, talk about your struggle, reach out for help, and try again tomorrow. So what does self-care look like? For me, I took the kitchen shears to my hair, and I paid my hairdresser in advance for the fixed job she's going to do. I told my daughter, have at her. I took photos for my hairdresser and I had a good laugh. And now my hair isn't making me crazy. It's less wild, win-win. And no hairdresser will lose a job because I know I'm not good at this. These coping skills are general, and you may have others that work for you. Some people need to be quiet and meditate. Others need to keep busy and have background noise. Your experience is your own. Know yourself. The framework for a treatment to manage reactions for better outcomes is 5 things: increased sense of safety, calming, connectedness, self-efficacy, and hope. So it's not necessary to have all 5, but implementing some of them may help you too. So an increased sense of safety. Share trusted information and resources on how to protect your health and well-being. Cultivating ways to calm yourself. Calming actions such as breathing exercises, stretching, yoga, music, time outdoors. Engaging in satisfying activities. Reduction of unhelpful strategies such as a reliance on alcohol. Practice less extreme ways of thinking to be both realistic and helpful. For example, Bad things might happen, but add the thought, if they do, I can handle it with help. Staying connected with others as much as possible. Social support is a strong protective factor in adverse life situations. So increase social support by offering flexible and creative but feasible ways to access people. Improve sense of self-efficacy. So self-efficacy is the feeling that you have the skills and resources to get through difficult times. We might say resiliency. Encourage people to seek out mentoring or information to help make decisions. Encourage them to revise their priorities. Encourage them to make concrete plans to mitigate their stress reactions. And remain hopeful. Hope is defined by researchers as the expectation that things can work out. Optimism about some aspects of the situation or a connection with something greater than oneself. It's related to improved outcomes in extended threatening situations. So the guidelines on a psychologically safe workspace don't cover this. There are legal issues to knowing more information about your employees and their families. And if you're trying to keep them working and paid through this, or if that's not possible and you want to bring them back to work after this, even a check-in with social supports will make a difference. Providing mental health helplines helps, and I appreciate your efforts. So let's talk about families through this. Whoops, I went too far. Yours, your employees, your neighbours, they might be more vulnerable than you think. Youth, suicide is the second leading cause of death. So it's something to keep in consideration. The statistics always show more males than females in a death by suicide, but any death is going to be tragic. And for every death in this age group, there's an estimated 1 to 200 attempts made. That means we have a lot of opportunity to intervene. In the context of family, there are predisposing factors, contributing, precipitating factors, and protective factors, and that's where I'll focus. Family cohesion and warmth, positive parent connections, positive role models, active parental supervision. The family holds high and realistic expectations and support and involvement of extended family. You may not be a caregiver to a youth, but you can be a positive role model. You have the ability to improve their resiliency. Just a quick check-in, some of those things I talked about. 3 breaths, adjust your schedule, ask for help. So you know that abuse or trauma will significantly contribute to developing a post-traumatic stress disorder and thinking about suicide. When we think about children, there are some of those factors that hopefully are not within your control, but you can help them. These are older statistics, but lesbian, gay, and bisexual youth are more vulnerable to suicide attempts and death. And I want to remind you, it is a factor, that social connectedness is a factor to a suicide loss. I want to think that we have a great society here in this region, and they are very active, very encouraging at any reductions of stigmas, so that we have a better news story than general statistics is really important. Cyberbullying is on the rise and can be a contributing factor. Consider the youth in your circle and a safe digital footprint and technology use. Training for them and for you. When you're talking to staff that are working with families in their household all day, consider that they also need to be parenting and raising healthy families with healthy relationships. Discuss your expectations with them and keep them realistic. Tell them how important their family's health is to you. You understand these are unusual circumstances, and ask about the people you see walking past their screen during Zoom chats. Hey, who's that? Tell them who they see when they're walking past your screen. Oh, that's my daughter and the dog. Increase your social connectedness for them and for you. Model healthy behaviors and turn off your availability at times. So overall, there are some factors that stand out in suicide deaths in youth. There are resources you can advise families in your circle about. They are for everyone and many age groups. There are a lot of people wanting to help build resiliency and coping skills specific to youth. So consider that. The one that I'm going to refer you to is, of course, the program that we run. That is the Breakfast Club here in Grand Prairie. So intake is through our website form. Anyone can refer. They do need a parent's permission. They don't need to be suicidal. Prevention is about building resiliency and teaching coping skills. So consider through this period, look at the Facebook page for the Breakfast Club. They have daily inspiration and tips. They are checking their sources, that information is valid. You don't want to send any family to an unmanaged resource. So I understand caution, especially after I talk about good technology use. But the Breakfast Club is vetting their information and they're sharing it in a youth-friendly style, way more so than perhaps the Resource Centre for Suicide Prevention. This is aimed at working with families and children. So they have contacted all of the families that are clients of theirs and managed resources digitally through them. But if there is youth coming into your circle that also need more assistance, this is how you reach them. And you should give them as a reference. They do a really great job. So whichever of these little Facebook shareable quotes or messages makes sense to you, read them, think them through. Take time for yourself. The same as an oxygen mask falling from the ceiling on a plane, you're asked to secure your own mask before helping someone else. Take it to heart because it's still true for this situation. The Alberta Health Services response to the current crisis includes this tool called COVID19 Hope, and it's evidence-based. It is daily tools to help you adjust negative thoughts, feelings, and behaviors. If you want more tools on your tool belt, this is one that I would recommend. So you're texting 393939 with COVID-19 Hope to subscribe. And it is a one-way service, not a two-way service. So that communication is not going to replace other mental health therapies, but it is an addition that you might offer to people that you're working with or to use yourself. I'm enrolled, of course, and so I get my tips every day. And just remember, again, hope you'll make it through this. Now, in the context of individuals, again, risk factors, let's look at protective factors. Effective coping, self-soothing and problem-solving skills. Willingness to seek help. Yep, that's you too, so I appreciate you joining the presentation today. Do you have a list of the people and supports that you would seek help from if you needed it? Follow some healthy habits, physically and mentally. Draw on positive experiences. Go through family albums. Remember happy occasions. Celebrate successes. And encourage people to do the same and share community successes and improve those connections and that sense of belonging. Share this with others and encourage them to share it with their circle as well. So the World Health Organization put out this information on coping with stress during this time. Share it with your colleagues, your friends. Give good information. Share good information. Sources are important, and if you're sending this out, the only added information I would encourage you to add is local helplines. We have a Getting Help PDF with the local contacts for all of the services that are available and open right now, broken into city, county, and further afield for reference. There's also references on our website, all the counsellors that are available and taking clients during this time, even though it is virtual. The 24/7 helplines and interactive websites, they're all on our website, places that you can reach out. So make sure it's part of your messaging when you're talking to other people, how to get help locally in addition to some of these coping skills. I swear we're nearly there. Safety planning and programs are the only portions left, and I do talk too much, so I'll try and speed it up. Safety plan. So take a look at our website, and if you're entering into a difficult conversation with someone, use this as a prod for how to help someone, and ask them these questions and ask them to complete it. It's really important that they lay their thoughts out, because then it's also a tool for you to know who they might be able to reach out to, what some triggering events or situations might be, what some warning signs are that are specific to the person that you're dealing with. It's never too early or too late to start healthy habits. Stop negative talk when you notice it. We all know this, not necessarily good at doing it. And this little Facebook meme I just loved. Where did you find that? I've been searching for it everywhere. I created it myself. So one of the programs that we have pivoted to try and deliver a sense of hope to some of the seniors in our community is the Friends from Afar program. And it is to connect seniors and community. So we have facilitated chats between volunteers, our support services, and seniors in different facilities. We have had some problems setting up the facilities with some of the devices. They just don't have Wi-Fi or technical skills, but I would still really encourage you, look for a way to increase your social connectedness, your community connectedness. There's a lot of information that actually speaks to there being a higher positive outcome from helping others than there is from personal, like taking a bath or relaxing to soothing music. So consider what you might do to volunteer in this time. Your physical health, your mental health, your overall well-being, it really does all matter. They're all tied together. If you make steps to improve one, it'll help with the other. Now, the Resource Centre for Suicide Prevention, we have a number of different programs, different services, different training. Our vision is to reduce suicide, to raise awareness and open the discussion around mental health. So to help us do this, this is some of the things that we do. Also, we have the men's support group, which has moved to a Zoom, and our training courses we're not offering digitally yet. We don't own the information, so we'll have to see what we can do. But applied suicide intervention skills training and mental health first aid training, if you want to know more, if you need to know more, there is training available that's 1 or 2 days that I would highly encourage. After taking the assist myself, I would recommend it to anyone. I have 2 children. I wish I had taken the training when my oldest was younger, because there's been definite red flags that I've seen during different friendships, and I wish I had been more able to have conversations and know where to look for help. So I'd highly recommend it. If you are interested specifically in help for your youth, you want to refer to the Breakfast Club. The Community Helpers Program does training in all of the schools to grade 9s, and because of the current crisis, they are working to provide that training to Big Brothers and Big Sisters mentors as our first trial of doing this, delivering it digitally. And our Tough Enough to Talk About It training has information from their program in this slideshow, and it's really about recognizing there's a large vulnerability in men 45 to 65 and trying to reach them through workplaces, through oil field industry and agriculture settings. Our assist training and mental health first aid that we offer with different specialties, either youth or seniors focused. So that is most of my information. Thank you for staying with us. And if you would like to reach out to us during this time, or to me, this is my name, my email address, our Facebook site, and how to reach us. If there are any questions, I'd be more than happy to take them. If you want to have a conversation after this is all completed, feel free to send an email or to send a text or give me a call, and I'd be happy to answer any questions. If I can work out how to stop.
All right. Thanks, Ainsley.
You're welcome.
Where we've got the first question right now. How important is it to keep routine right now?
I'm trying to bring you back up to a big screen. Bear with me for just a second. No, I can't bring up your chats. A routine's really important, actually. One of the things that you might find is having some kind of schedule, but still flexible, will help you manage your daily needs, and will encourage you to have small wins. You complete something and you have a success, which is always encouraging. I personally find it really hard to not be on schedule. So I have a daily and a monthly schedule on my wall next to my screen to survive with the new schooling requirements, and trying to manage that.
So one of the toughest things about mental health is that everyone needs different ways to deal with mental health, and not everything is a one size fits all when it comes to someone that is dealing with those issues.
Oh, completely. If there was one easy fix, it wouldn't be a problem. Like, mental health is complex and suicide death is complex. If they were simple, we would have solutions to them. You have a couple of mental health professionals I can see on the list here today, so they probably have answers to that themselves. I've tried to balance giving general overall tips on coping with some quite deep information about how to prevent or intervene in suicide death. So trying to find that balance is tricky, but those coping skills for someone who doesn't have a mental illness, who's just struggling with poor mental health, they're still going to be the same as someone who is also under a doctor's care and requires medication. They still need good coping techniques and better to improve their overall mental health as well. It'll act as a support to the medication and the professional help that they're getting.
I want to thank Jody for sharing this. Check out the app Virtual Hope Box to see if it's a good resource for you or the people you work with. What number can people call for the men's support group?
If they call my office, so 933-6144, or send an email, we keep the link private and we only send it out to participants each week, so that we don't have any adverse situations with people bombing into the support group. Or they can go through Facebook. There is a men's support group link on our Facebook account. And if they send a private message, so they don't have to be visibly joining the group, they can send a private message and we'll respond with the link.
Is the support group for men that are struggling themselves, or is it also open to people that are concerned about someone that they love?
It's a peer support facilitated group, so it's only for men. It's not for the wives of the men that are struggling. There are other women's support groups. So it is, they may be struggling with loss, or they may be struggling with a mental health issue, grief. Their reasons for requiring support can be many and varied. There's every age, from like an older youth to a man in his 70s. And it really is, it is facilitated, but it is men offering other men tips on how they coped, or offering suggestions for what might help them.
They meet once a week?
Once a week, every Wednesday, 7 till 9.
Okay.
And it's the only one in the north, so I'd highly recommend it.
Probably getting a lot of calls about that right now. What has it been like for the office since early March?
So we moved to working from home, and we've had terrible trouble getting TELUS to transfer our calls. So we set up this new number, which we've broadcast widely as the new number. So we check the voicemails in the office every day, but this is the one that we answer. We've gone from crisis calls, probably 9 in a quarter, to 13 in 3 weeks. So there's a lot of people that are struggling. And according to the Center for Suicide Prevention out of the US, there is no reason to believe that there will be an increase in suicide loss because of a widespread pandemic. But the financial crisis at the same time will actually it will see an increase in help-seeking behaviour, and there has been an increase in helplines responding to crisis. So what we're seeing is the same as what everyone else is seeing as well.
You knew they were going to get a comment about this. Ainsley, that's a lot of yarn. And is that a stress relief project or a hoarding project?
I knit hats. I only know how to knit hats. And as soon as I'm finished one, I get a massive sense of satisfaction. I was like, oh, should I hide the yarn? Do I really want you to know what my secret self-soothing technique is? Sorry.
No, it's great, but I mean, it just kind of goes to show that everyone does or deals with stress differently, and it's about trying different things and finding things that that work for you.
Completely. And honestly, even if I'm not knitting, when I look at all the pretty colors and the pretty textures, I actually get satisfaction out of that. So this is my living room. This is where I made my workspace, and I still get the enjoyment of all my pretty things.
How important is the relationship between employers and employees right now? Like, I mean, it's stressful for the employees, but it's also stressful for the employers, trying to keep their businesses going, dealing with layoffs, people that they really enjoy working with, and you know, and vice versa, and making really tough decisions. That sort of relationship, like what how do you see that right now?
It's really stressful. We're all human and doing our best. So there are days when I feel super productive and I'm plowing through my work and I'm super impressed with myself. And then for no reason at all, there are other days when I'm distracted and I can't complete my reporting. And no matter how I try, I can't find the right words to say what I'm trying to get across. And I go for a walk. I take the dog for a walk. I find that I need to be doing something else, whether it's going outside. Outside is perfect. I'm so grateful the sun is shining. But you try one thing one day and it works great, and you try it the next day and it's not the right fit. You just have to keep on trying. This is a really stressful time, and I would just remind everyone to be incredible, because if you think about that information from Veterans Affairs about PTSD and quarantine, where after 10 days of quarantine, there's your dogs. After 10 days of quarantine, yeah, you get the same reactive behavior as a PTSD reaction. So avoidance and anger. So there's a whole lot of people that are dealing collectively with a trauma that are not responding with clear thought. Give them more space, hope, offer them helplines all the time. I'm glad that's your dog, not mine, for once.
He's small, but he's got a big voice.
Yeah.
We do have another question here. My problem is being single put on me to ensure I wasn't alone on holidays, always could make sure I did something or went somewhere. This Easter really did me in by having to sit home alone with no one, not being able to go anywhere for my mental health. Since then, it's really noticeable and I feel like I am in jail. I think I need to find a bicycle and start a new routine. Still upbeat though and smiling, and work and all my Zoom meeting friends are all supportive. Yeah, like, I mean, some of us are fortunate enough to, you know, be isolated, if you want to call it that, with family and, or, you know, in some cases, I guess, friends. But there are some that are going through this by themselves. And what kind of things can you suggest or share with them?
So social connectedness, one of those coping skills. So every Tuesday night, I conduct myself really poorly and play Cards Against Humanity online with a group of other people all over the province, actually, which is super fun because I never would have made time for it otherwise. So I learned to use Zoom and learned to play Cards Against Humanity and say terrible things. And I drink a glass of wine and have a fancy dinner because it's, you know, it's socializing night. If nobody in your friend group is trying that, then maybe it's up to you to try and see if that will help. I would also encourage you to find ways to volunteer. So one of my suggestions is the Friends from Afar program or the virtual pen pal. So if you don't want to use your internet and have a conversation with people, then writing out a little bit of information about yourself and a photo or a picture, things that you enjoy. If you scan those or send those into hospice and palliative care, then they screen them, they print them, and they send them to all of the seniors facilities in the north that are part of the program. So then your story is actually getting shared with potentially hundreds of people who are also feeling isolated just like you, and you're making a big difference in their day and in their week. So there's a lot of positive outcomes in supporting other people. So I would try and find some of those. You're not alone. We're all collectively experiencing this, even though we're experiencing it differently. We're all having good days and bad days. And so recognize what works for you and try something else.
One of the things I've heard is that, you know, people living with younger children or maybe dealing with, you know, some older relatives or loved ones, trying to be able to explain to them why we're doing what we're doing, and sometimes that can add to stress as well.
Oh, completely. And we all parent very differently as well. So just the way that you parent is not the way your neighbor parents. So they may allow different behaviors than what you do in your house. It is never more noticeable than now when so-and-so is having a sleepover. Why can't I? Because we follow public health orders. Parenting isn't easy. It's a job, and it takes a lot of time and attention. I have a lot of information that I use for particularly young children. It's more related to loss, but a lot of those things are the same. If you use really simple language, clear and concise language, don't change the words that you're using to baby something, but try and explain it clearly and simply when you're in a good state to have a discussion about it, and then see if that fit, answer their questions. There's actually a whole bunch of tools on speaking to children about coronavirus, and they're all on the Breakfast Club Facebook page. So I'd encourage you, if you have small children, to look, well, any children, to look there, because there's lots of different things there.
That's great. I know you folks have done a lot of presentations for companies, and I know that's not an easy thing to do now, and I know companies are, you know, maybe not looking to do those right now, but that's always been a really important part of the center as well, and being able to do presentations for employees and kind of give them an idea of things to watch for as far as stress and depression and are concerned.
Yeah, it is really important, because mental health discussions are not easy to have, and people don't want to get it wrong, and so they'd rather say nothing than get it wrong. But it's not about getting it right, it's about having the discussion and just opening up to trying. And ideally, we're in person and we can see people's faces, and if they're getting obviously upset by the conversation or triggered by it, then we can follow up with them, because we're all in the same room together. When it's a presentation that's using technology, it's not the same. I don't get to see everyone's faces or their reactions to some of the information. And even though we will do our best to meet a rural need or a long distance need with technology, I think there's always going to be the preference for having a face-to-face conversation. And there's lots of people that are experiencing that themselves. You know, Zoom helps, but it's not the same as the real thing. We do our best.
You know, you do, and having been on both sides of that conversation, I know how important it is, and it's life-saving. And we really appreciate you taking the time to join us today and sharing some tremendous information. And I know you folks are available, and we we as a community, I think, really appreciate that, and I hope we can continue to support you. We want to mention that the Resource Center for Suicide Prevention is on the list of mental health crisis resources on the GPREP website, the Grand Prairie Regional Emergency Partnership website. So gprep.ca/COVID-19/mental health. This has been terrific. Like I said, I really was looking forward to this, and I know the work that you folks do over there, and I know that it is even more important now in this time, and will be going forward here. So thank you very much, Ainsley, for doing this for us. And we wish you and your crew the best in continuing to do the great work that you do. And like I said, hopefully the community continues to support that as well. We're going to do another webinar next Friday. We have Ryan Blay from 910 Incorporated lined up to do some discussion and presentation about marketing right now and media and that sort of thing. If you're not really familiar with the Business Resiliency Task Force, it's the chamber in the city and the county. We have a #LoveLocalGP campaign running on Facebook with chamber checks able to be spent with any of our members. And it's just a way of supporting the business community right now. And whether you're spending money with them or you're just a fan and you want to make sure people are aware of who they are and what they do, tell us about it on the Facebook, and just share it everywhere on social media. Somebody will see it, and it's important to do that as we go through this. We have a business advisory services voucher program right now that a number of businesses are taking advantage of, working with Community Futures and their resources, and it's something that we hope can add a little bit of hope to some of these businesses as well. And our Business Resiliency resource page on the Chamber website has a list of resources. And we get it. We know it changes every day, and we try and keep it up to date, and we try and keep sharing information, and it can be overwhelming, and it can lead to stress. And hopefully you got some coping skills and resources from Ainsley. And anything else you want to add before we wrap this up, Ainsley?
There's a whole lot of information there. I know it can be a little overwhelming. Thanks very much for having me. I tried to cover a whole lot and not sit on one thing too long. But if there's anything that people would like more follow-up on, I'm more than happy to respond, whether that's an email at a later date or a phone call. Thanks for having us.
Thanks, Ainsley, and thank you to the comments coming in on the chat. We really appreciate that. So everyone, enjoy your weekend, and as we said, we're in this together. We'll get through it, and we'll talk to you again next week. Bye now.
Happy Friday.